let's go around the room and introduce ourselves. Let's start on screen. We have Beth and Paula there. Do you want to just kind of briefly introduce yourselves and where you're representing from?
Sure. Beth Killian, Trempealeau County Supervisor number 7.
Hi, Beth.
Good morning, everyone.
And Paula?
Hi, everybody. I'm out in Oakland, California, joining you. So it's nice to see everybody.
Good for you.
I'm retired, so that's why I can be out here.
Hello.
Yeah, thanks for joining us.
Sure.
Okay, Ashley, we'll go this way.
I'm Breckie, the Nutrition and Transportation Coordinator for the ADRC.
I'm Jeannie Nutter. I represent District 15 on the county board, and I'm part of this committee.
Eileen Harrison.
Push your button, and then when it turns red, that you'll be on.
You can talk.
Okay, Eileen Harrison.
You can bend your mic down a little bit too, though.
Nancy Hummel, and we're both from Gillsville.
Oh,
It
okay.
bends really easy.
Mary Beck from Whitehall.
Ruth Gulligsford from Strum.
You know why it's that big?
Go ahead, Ellen.
Well, I was going to say Omar Sharif. I could tell you my Omar Sharif story, but you don't have time for that. My name's Alan Robertson, and I live in the city of Blair. I've been there since 1968.
Becky Woodkey, Dementia Care Specialist for Trempealeau County.
Sammy Becker, Administrative Specialist for the ADRC.
Sam Tetzloff, Administrative Specialist for Human Services.
Melissa Youngbauer, ADRC Supervisor.
And I'm Scott Brown, representing Whitehall, and also the area of developmental disabilities. Each of us has a specific spot on the board. I think when Melissa's talked to people, she has tried to incorporate each of the different disability areas that the ADRC is responsible for. So there's quite a diversity of experience in the room, and we appreciate the fact that you're all here this morning. Thank you for coming. It was nice it wasn't beastly cold today, so we hit a good one. It's going to be even warmer when we leave. So, okay, the open meeting law has been met by the proper posting. We have an agenda in front of us. I entertain a motion to adopt the agenda as printed.
I move to approve the agenda. Adopt the agenda, I mean. Sorry.
Ruth, are you seconding? Yes. Okay, Ruth will second. All in favor say aye.
Aye.
Opposed, nay. Motion carries. Thank you. We have the minutes from the previous meeting. Are there any questions about the minutes that we need to review before we adopt them? Hearing no questions, I'd entertain a motion to approve the minutes as presented.
So move your arm.
Okay.
I'll second.
It's been moved and seconded to approve the minutes. All in favor say aye.
Aye.
Opposed, nay. Motion carries. Former judge calling me your honor. That's about the highest compliment I've ever had. So thank you. All right, well, we'll jump right into the ADRC community engagement and program updates.
Okay, thank you, Scott. Just wanted to give a few updates about the ADRC and how things are going and what we are doing. So did want to introduce Sammy Bacon. So Becker, I'm sorry. Oh my gosh. You know where I got that. So Sammy started the first Monday in January, so she's been with us for a little over a month, and she is doing just tremendously. So we are so happy to have her here. It just seems like you've been here much longer. Sam is here, helping Sammy just do minutes for the first time. So that's why we've got kind of this heavy presence here today from the ADRC. So just wanting to give her some support. We'll just kind of do just a brief staffing update. All the positions are full at the ADRC now. So yay. That's the first time that's happened and pretty much since I started back in April, I believe. So that's just, wonderful staffing to have everybody's positions full. And I think we've got just the right team right now in place. So very, very happy for that. Just a few other updates. One of the big things that we started here then in 2022 is our Strong Bodies program. So that we have talked about in the past. A program like that takes months actually to get off the ground and running. So we had, if you remember last year, we had sent Nancy Lingen and Amanda Heggie to Madison for training. Strong Bodies is an evidence-based strength training program designed to help older adults become and stay strong, fit, and healthy. It includes resistive training, balance training, and flexibility exercises. It's proven to prevent osteoporosis, build muscle, improve balance, as well as decrease depression and arthritis symptoms. So we started ADRC started the Strong Bodies program in January. It started January 4th. Happy to say that there are 10 people that did get enrolled in the class. We had a few people that had expressed interest but then did not follow through with all the requirements of the class, which did include, filling out paperwork and getting a doctor's approval in most cases. So we had a few people that then just didn't follow through. Yeah, there was some paperwork. But there were 10 people that did sign up for the class. The class is meeting Tuesdays and Thursdays. It's a 12-week class. Mary Lou, you kind of mentioned, yes, that you are participating. Please tell us about your experience and how it is going, if you would.
First couple weeks, I was kind of sore, but it's fun. It's a different kinds of different exercises we do, and some of them in a chair, some of them we have march, and that, and so we decided to walk and march at the same time, and it's fun. It's excited. I can't go on the floor, so we do the raw exercise, and it's different. And I even lost weight. So
Yay!
And I feel good.
That's good. That's testimonial. Yeah, it's great. It's really good. So this class is held at the Brookside Apartments over here in Whitehall. It's great because there is no fee for the space. It's ours to use, which has worked out really, really well. It's a fully accessible building, which is great. I had Amanda Heggie, who is one of the instructors, contact me last week, and she said people are getting stronger. So 1 month in, and she requested higher weights. So that's great. I mean, yeah, so people are getting stronger and healthier. So that's great. So yeah, we had extra weights at the ADRC, so we got them over to her, and she could start using them this morning then. So just kind of wanted to just review. We are just happy that we got that program up and running and off the ground this year. Definitely the goal is that we want to get more people trained, and we want to offer it in more locations. So it's a start. 10 people are getting stronger and more fit than they were. So yeah, I'm glad that there's such energy and enthusiasm. So yeah, hope to bring that to other places in the county. I know already talking to Amanda and Nancy, they hope to offer it again here in Whitehall. Both of those ladies are from the Blair and Whitehall area, so I feel like, just the goal would be to get other instructors from other parts of the county. So if you know of people that may be interested in obtaining training, let us know. We do have funds that we can use to pay for that training. I haven't seen, typically they offer them in Madison. Last year they did not offer a lot of the trainings because of COVID. But I'm sure we can expect that there will be a couple trainings again in Madison. They have offered them in other parts of the state as well. So that is strong bodies. The other updates that I have really, I'm going to, if you look at the agenda, we have coming up, we have nutrition information that we're going to be sharing. So we've got some updates with that. And then we have Breckie, our dementia care specialist, too, that's going to be giving some updates about some of the programs that she's working on right now. So that really is all that I have.
Any questions for the moment? I guess Melissa explained it very well. Didn't have questions. So thank you, Mary, for your testimonial, and appreciate that. Sounds like a good program.
I have a question.
Yes.
If I have someone who might be interested in being a trainer, should I just have her contact you? Because it would be in the northern area.
That would be great.
Okay.
Yeah.
All right, I'll let,
Yep. Have them contact me.
okay.
Sounds good. Well, next on the agenda is council membership and election of officers. So, you have a listing of some people
Yeah,
that are...
what I will just let you know is that Linda Shafer, she had been on the council. According to our bylaws, I believe it's 2 3-year terms as the maximum that a member can have, and she had reached that. So she fulfilled her 2 3-year terms, and so back in January would have been her last month on the board. She was very happy to have served. I certainly invited her to come to future meetings, which she may do. She is one of our volunteer drivers, so just want to recognize her for that as well. So she's very much still part of the ADRC.
And she
So.
also is one of the exercise
Yeah.
people too, so.
Okay. Yeah, so she's still, I think, will be very involved with the ADRC. But that does bring us to the fact then that we do have one opening then for our board. And so Eileen Harrison, who has, I think since I've started, Eileen, you have been at most of the meetings, if not at all of the meetings that I've attended. So I believe that Eileen has shared or has expressed some interest in being on the board. Is there anything that you'd like to share with the board, Eileen? Anything about just, you said earlier you're from Galesville, I believe. Yep. Is there anything that you would want to add or mention as far as your interest in?
Yes, I have to learn as I go along because I'm not really sure what is totally involved. So.
Well, I think one of the main things is you've been attending, and so you have an interest.
Yeah.
So I think one of the main things that I view the council, one of the needs of the council, one of their main duties is just providing feedback because you help shape what we do and the programs and services that we do. But it's also to be somewhat of an ambassador, so like a goodwill person to help educate our community and let them know about the things that we do, the services that are available for people. So it sounds like that's something that you're interested in.
I could do that.
So you should be on the board.
Yes.
No, let's not go that far yet.
Well, you're doing it right now, just being here.
Yeah, just being here.
Sharing, that's all you have to do.
You need to vote?
I believe so, yeah.
Okay.
Yeah, and then it would go to the Human Services Board.
Okay. We need to, someone to nominate for the board, and then we'd second that, and then we'd do an approval. And then Melissa just said it, and it has to go to the Human Services Board. So I'd like to entertain a motion for nomination. Anybody want to do that for Eileen?
I'll do it,
Ruth?
Scott.
Oh, Paula,
I'll second.
we've got two motions and a second. Ruth stuck her hand up, Paula, so.
That's
And
okay.
then Jeannie Nutter has seconded. All in favor signify by the sign of aye.
Aye.
Opposed, nay?
You're on the board.
I guess so.
Yep. At least today, it'll be official with the Human Services Board, so thank you very much for your ongoing attendance and,
You're
you know,
welcome.
Yep,
and
thank
into the
you.
future. We appreciate that. Do we have to do any
We
other,
have to look at
all the rest, or?
The only thing we have to look at is election of officers.
Okay.
And to my knowledge, you're the only officer.
Is that right?
I think so.
Oh.
I don't know if any
Okay.
others.
The next is election of officers, and we're thinking that the chair of the board is the only elected position, and I've been holding that, and so I'd entertain a motion for nominations of someone to be the either the ongoing or a new chairperson. Alan?
I would nominate Scott Brown for chair.
And I would second that.
Okay, thank you. It's been a nomination and a second. Are there any other nominations for chair?
I move nominations be closed and we cast a unanimous ballot for Scott Brown.
And I'll second that.
Okay, all those in favor of unanimous ballot, please signify by saying aye.
Aye.
Opposed, nay? Okay, I guess it was unanimous, so
Thank you, Scott.
it all worked out. You're welcome.
Obviously, we all appreciate your work as being chair, so thank you so much.
It's not super hard when you've got staff members like all of these ladies that are doing all the work, and
No, it
just
just,
being
it
a-
makes it so much easier just having you available and leading this, so thank you.
Good, thank you.
You did a fine job.
Well, thank you, and thank you for your support. Appreciate that. Okay, review of 2021 HDM and senior dining survey results.
Okay, again, I wanted to introduce Ashley Breckie, who's sitting over to my right, who is the ADRC's Nutrition and Transportation Coordinator. So back in the fall, the GWAR, who is basically our governing board, had all of the nutrition programs in the state complete surveys with our home-delivered meal recipients and our senior dining participants. We had a really great response to this. You know, sometimes you have surveys completed and you just kind of get a lukewarm response, but we had a stack like this of responses from both of the programs. So I feel it was a really just accurate reflection of just what our participants have to say and what they think about our meal programs. So I did I distributed what the results were so that you can all, look at this. Just to kind of highlight a few things. The first page is the home delivered meal survey results.
Can I just say I
Yeah.
like how you did this?
I'm going to be honest. GWAR did do this.
Oh, they did?
Yes, they did it for us.
They did this format for you?
Yes.
I really like it because it's like one of those cloud, whatever they're called.
Yeah.
Word clouds.
Mhm.
So easy to
Yep, I love it. I know.
Well, thank you, GWAR.
Yeah, thank you, GWAR. Yeah, yes. I think it's really nice the way they did it.
Yeah, it's easy to read, and I love it.
Yeah, it's really, really good. But you can see, you know, our home delivered meal participants, these are individuals that are homebound, that have difficulty, you know, getting out and getting their nutrition needs met. And so you can see that 86% of these participants that responded live alone. Many are feeling as though they lack companionship, they feel left out, they feel isolated. 21% of these folks had zero visitors, 0 to 3, or had zero. 21% had zero visitors in the past week. That's what we hear from our drivers, though. They do become like family, and a lot of times they are doing those just unmet needs, such as helping with pets, helping at times do some just easy shoveling and clearing off of steps and decks and that type of thing. And just they get to be like family. They really do. And when they come in and talk to us, these drivers, about their experience, you can just tell there's just a real connection there. So I think this is just telling us that there is a need. The other thing that I want to just point out is the high quality. The respondents, 92 are saying they would 92% would recommend the home delivered meal program to somebody else. 90% said the food usually or always tastes good and looks good. 87% said the hot food arrives hot and the cold food arrives cold, usually or always. So I think that's really, really good. I think most restaurants would be really happy with those kinds of results, to be honest. So I think that's really great. Testimonials and the impact of COVID, just, you know, people are saying, or a person said, a great program. I was a caregiver all my life, and I enjoy being on the other end of the cycle. At 95, I really appreciate these meals and the brief contact with the cheerful deliveries. Impact of COVID, somebody said, nice to know somebody's coming and checking on me. I don't have to go out in public and get a well-balanced meal. So just wanted to, on that third page then, I just did a brief snapshot of our home delivered meals. In 2021, we delivered almost 26,000 meals. That's a lot, I feel like. I was surprised to actually see that. So we have, you know, Ashley every day that is working on the front lines of that program and making sure we have drivers and making sure that the counts are there to the providers. It's a lot. So I just want to commend Ashley for all of the work that she does. 26,000 meals, and just that it's such high quality. Just had been in Ashley's office yesterday when one of the meal drivers came in, and Ashley took the temps. That's a requirement that we do that every month. All of the routes have temperatures taken, and just to see that process, the temps came in. So, you know, they're loaded up around 10 or 10:30 at the restaurant, and then they go out. And this was like around 1 o'clock, the temps were taken. It was actually a little after 1, I think, and the temps were all where they needed to be. But that is the kind of checks and balance that is done to make sure that the food is of high quality. So right now, just to kind of review or to remind people, we have 3 providers for the home delivered meal. We have Rainbow, Dove, and Grandview. There's 6 different routes right now, so there's 6 different drivers every day that are going out and delivering those meals. In January, we had 2,046 home delivered meals that were delivered, so pretty consistent. The numbers right now are about the same. But that is our home delivered meal program.
I have a question.
Sure.
What is Dove?
That is the nursing facility in Osseo. So Dove delivers the meals to, we have drivers that go then to Dove every day, and then they pick up meals and deliver them to the Osseo and Oliva Strum communities. Yeah. We currently have 106 seniors receiving meals. So not all of them receive meals every day. People have a choice. They could receive a meal from 1 to 7 days of the week. The weekends are frozen meals that are delivered, so.
Could you give a brief explanation of who qualifies for the meals?
Yeah, so for our home delivered meals, individuals must be considered homebound. However, there is a nutrition assessment that we do when people start on the meals, and then we do those assessments again annually. And so we do ask questions about, isolation. We ask questions about people's ability to get out, whether they, are driving and can get out to stores or restaurants, that type of thing. Also ask just about their health status. So there is an assessment that is done that does signal whether or not a person does qualify. So
Payment of that is sometimes by Inclusa and
yes,
sometimes,
correct. Yep.
Sometimes private pay.
Yes, we ask for a $4 donation for our meals. It's up to the individual as far as how much they do pay. The actual cost of our meals is $13.73, and so again, we ask for a donation for the meals. However, if a person does not make a donation, that does not exclude them from receiving a meal. It's just a suggested donation. So, but like Scott said, there are the family care organizations such as Inclusa or My Choice. If a person is enrolled with them, the Inclusa or My Choice will pay that cost of the meal. So.
Excuse me. One of the ladies that got the meals, she said, "Oh, they good."
Oh, good. What community is she from, Mary?
She's from, she's up at Brookside Apartments.
Okay.
So, and she said, "Oh, they're so good." And she said, "I can't eat it all, but then I save it for supper." She said,
That's good. Mary, you're just being quite the spokesperson for us today.
know, she's
so
a
that's good.
She's a
That's
good ambassador.
I'm glad she's having a good experience.
Jeannie has a question.
Yes, Jeannie.
It's not a question, it's still, I can't get past this risk factor on the first page of people not, of being so isolated. And 21% had no contact with people except I don't know if somehow, sometime in the future, we could think outside the box and figure out how to have a home visiting program or something. I mean, to be alone in your house and have nobody see you, 21%, that's huge to me. I'm just kind of freaked out by that. I'm sorry. It's,
And I think
it's a little
it-
shocking to see 60% lack of companionship, 47% feel left out, 42% feel isolated most of the time. I feel like I just want to get in my car and go visit these people.
Right. But I do feel, just the other data we've gotten from when we even did our just ADRC surveys, that was just the most dominant theme there too, was people feel isolated, they feel alone. There's this lack of just belonging.
I know, it's kind of frightening to me. Maybe it's because...
And I don't feel it's just isolated to seniors either.
Right.
I think just in general, it's just...
And I don't know if some of it has to do with COVID, that people just were not seeing people.
I think it does.
But I'm worried about how we bring people out of this isolation and back into the sunshine,
Right.
you know?
I think I've just seen some recent articles too about just youth and how COVID has impacted them. And I just think it is across the board.
Right.
And it's just, I think it's something that should be on just all of our just radar, and how do we
Kids have their, they can communicate through TikTok and everything else, but 85-year-olds aren't going to be talking on the internet. I mean,
Right.
it's just, it just was striking to me. I don't have an answer, but except to me become a home visitor.
Yeah. And that's what we, it's kind of a balance too, because we have to deliver the food timely. It affects the temperatures and the quality of food. But yeah, when you go in and, Ashley does deliver meals at times when we are short drivers. And so she's experienced that firsthand. And you want to stay sometimes and just visit with folks because there is that need and just that want for companionship. But yes, how do you, Do you have anything about home delivered meals that you'd like to share, Ashley? Just from your experience in delivering the meals? I'm putting you on the spot. Yeah. It's enjoyable. I know Ashley, when she's done that task, comes back, and I can just tell you enjoy it. And
I absolutely enjoy it. Just getting out and meeting the people that you're working and servicing, you can put a name to a face. That's big for me. You get to know kind of how they function and, how their living situations. One of my favorites is a gentleman from Galesville is blind. So when you get there, normally when I do them on Wednesdays, he'll ask me to put the meal in the fridge because, he goes out with the guys one day a week for lunch. But he's so cute because the one day he asked if I could help button his shirt because he couldn't, So you just get that interaction and you get that extra sense of getting to know them a little bit. So overall, it is truly rewarding as far as, getting out there and getting to know them.
Right. I think I've said this story before, but we have a gentleman that has a dog, and he lives alone, and he had nobody to help him give the dog eye drops and medicine, and so our drivers help with that, and it's those kinds of stories that just make you realize that it's more than a meal.
Right.
Yeah.
Maybe I need to work for the ADRC. Maybe I need to be a driver.
We need drivers, so yes. We do have people, our newest volunteer, we had somebody start, I believe, in December. Ron? I think so. And he just delivers twice a month when the regular driver from Blair, who is also a volunteer, and she can't deliver 2 days a month. And so Ron delivers twice a month. And so we would certainly we would be pleased to have anybody that's even willing or able to do it for a couple times a month. We do training, so we'd have the volunteer ride along. 2 to 3 times is usually what people like to do to kind of feel comfortable doing it themselves. Sammy's done it a couple times already since she's started. But we give you the training, and there's a route sheet so you know exactly the order of how to deliver the meals. So it works pretty slick. Most of the routes take about 2 hours from start to finish. So.
Surveys are a shot in time. I think Melissa said in the past week, how many have not had anybody visit? Well, I haven't had people visit for months. I can get out, but it maybe isn't as bad as it seems here. But I would guess there are a lot of people out there that don't get visits very often and would love to have someone.
Yeah, I think that's been a little historical with Trempealeau County, is just the way we're set up and lack of transportation, and people are isolated. So okay.
Yeah, I just wanted to get back to that confinement issue. I know 2 people who were having a lot of trouble with anxiety, and I talked them into trying church activities. Now, I don't know how vocal we can be on promoting church. Is that okay? It should be, right?
Yes.
Yeah, because we have, at our church, we have quilting on Tuesdays, we have a service on Wednesdays, and then the Sunday service. It's not like the churches have shut down. Just become aware of the church that you would like to go to does have things to do.
We can't obviously promote any particular faith, but promoting churches as a social gathering of other people in their community, again, not the service piece of it, but the quilting, the other type of events is something that we can do because it's a community effort. So that our only limitation is again on promoting a certain faith or promoting the church mass or the service, whatever piece of it. That we can't do. But the other, I mean, there's, like you're right, churches do so much more than just a service or a mass.
And I was referring to members of my church that I talked to, so it didn't matter that I told them about the services. Thank you.
Thank you, Deb.
I know that there's a group of women, and I've gone a couple of times, that meet at the Foolish Pleasure is a bar in Strum, but it's totally changing. But this group of women, my age and older, meet every morning for coffee, and it's just some drive, some walk. If the weather's bad, they can't. But I mean, to try to set up things like that in various areas. I mean, it just, for me to just go and, Ruth, you've been to that. You're there sometimes, aren't you? Oh, okay. Well, it's just like a lot of fun.
And, you know, that, I think you've heard me speak before about, you know, our community center, our senior centers. That's the kind of thing that ADRC can be a part of. But it's how do we bring all of the pieces together to meet all of those needs of a community, so that people, you know, to promote health and wellness and I think, you know, intergenerational opportunities. It's just how do we meld all of those? So
I think turning 70 today might have freaked me out, which is why this has become so in my face today.
Yeah.
There is a resource that's available for people with anxiety 24 hours a day, 7 days a week, and that's the National Alliance of the Mentally Ill. And I've got an 800 number. It's 1-800-950-6264. And there are trained people on the other end of the line, and they get thousands of calls a day. And like I said, it's all night long as well. So if you've got somebody that's 70 or so, that's anxious and they can't sleep, they could call this number, and the person on the other end would be willing to talk to them and make suggestions. Trempealeau County does have an affiliate for NAMI. I'm actually the president of that as well. But they have lots of resources available to people that have challenges with their mental health. So just something that is available all the time. And if people like to text more, so there is also, you can text NAMI, capital N, capital A, capital M, capital I, which is the National Alliance of the Mentally Ill. And you text the number 741741, and then they can help you on the other end of the line. So just one more resource.
So, go ahead.
Lived at Brookside apartment for almost 6 years now, and half the people I didn't even know because they stay in their own apartments and that. And then this one lady, she came and she said, "Are you new?" And I said, "No, I've been here for about 5 years." And she says, "What's your name?" And I told her, and she said, "Well, glad to meet you." And I said, "Glad to meet you too." But it's a lot of them just want to be by themselves. And me, I have to go out walking or something because I can't just sit in my apartment. I have to get out. That's why I like being here because I get out.
Okay, well, thanks for all the input on the driving program, the meal program. It's great. So next.
You all, I'll just
Dementia Care.
update
Oh,
quick of the senior dining. No, that's
Oh.
fine. There are some survey results specifically from the senior dining. It does have risk factors again. As we would expect, these are the folks that are getting out and going to meal sites. So, 13% are saying that they feel they lack companionship, so they're feeling less isolated or alone. People are saying they're feeling welcome. They're saying they feel they usually or always fit in. So that's good. Looking at the high quality, very proud of that. 100% of participants would recommend our senior dining to other individuals, and 100% said the food usually or always tastes and looks good. So, so that's great. So just to review, in 2021, we had 4,530 meals that were served out of our sites. If you remember, we didn't reopen our sites, which were closed due to COVID, until June of 2021. So that's a lot of meals in basically 7 months. And we currently have 4 meal sites: Boondocks, Rainbow, Pine Creek, and Wannick Center. So, and if you recall, really, one of our goals of our aging plan is to increase dining opportunities to the northern part of the county. So that's something that we'll really hope to get to work on here in the next month is kind of my plan, just to starting to meet with people to get their ideas, and then we will be having listening sessions in the northern part of the county to make sure that we are doing what residents want in our county. So, yes.
I am looking down at the suggestions.
Mm-hmm.
Where did the less politics come from?
I know, I was wondering what that was. Or maybe you're in a restaurant and people are.
I really don't know, because we certainly do not promote any kind of agenda, politics. It's not something that we ever, we don't.
I think that's the registration form that this individual is referring to, because we asked him to do a reassessment and it was on his assessment form as well. So I think it's just the enrollment process they feel is maybe overwhelming, but that's coming from the state.
So again, those registration forms, they give us the specific form that needs to be used. It has questions regarding income, ethnicity. Participants have to complete a date of birth. So I don't know. And it does ask a series of questions regarding their level of functioning. So just so people are aware of that, but we need to submit all that information to the state to, that's how that works.
Sure.
So.
Less policies,
Less
bureaucracy.
Yes, yeah, we're unsure. So again, these surveys were just, sent to all of the participants, and the state, we gave them, Ashley submitted them to the state, and these sheets that you see that Jeannie likes, Guar did those for us. So they're the ones that, compiled the actual data and wrote the comments, so, yeah.
Thank you, Guar.
Yeah, thank you, Guar.
What does GWAR stand for again?
Wisconsin Area on Aging Resources.
There you go.
Thank you, Deb.
Mm-hmm.
Melissa?
Yes.
This is Paula.
Mm-hmm. Hi, Paula.
I was just wondering, is there a time frame that those assessments have to be completed by the state? Because when I did it at Sunflower, you're sitting there with 2 or 3 other people and you have to fill out this form, and it kind of intimidated people. And I was just wondering if there could be like a self-addressed envelope and they could send it back to ADRC.
They certainly could. The requirement is just that they're done annually. So you can imagine there's probably, how many participants would you say, Ashley? I mean, hundreds of participants. So it is somewhat of a tedious task to keep track of those. So the way that we are doing that is that at the first of the year, we're trying to obtain as many as we can, and that's the way that we would handle that moving forward, is that we would do those at the front end of the year for completion. But yeah, I think what Paula is saying is, yes, certainly there are some people that there is a hesitancy to complete those forms. And certainly that is an option. People could mail them to us. People can bring them home and then bring them back. I think what we can do, Paula, is just remind all the staff at the sites, the volunteers and the staff, the paid staff. And that is actually something that we actually met with 3 of our sites last week. We're going to meet with one other site tomorrow. But we're having that conversation about the need, at least, to get the date of birth, because we need to have that, or people, it's a problem. We get errors on our reports, and then we don't get compensated from GWAR for those folks that we don't have, documentation that they are 60. So, yeah, I think it's just something that we can continue to remind volunteers and staff of when completing that form, that there are options. Does that make sense, Paula?
Yeah, and I was referring primarily towards the new people that we sign up.
Okay, yeah.
Because, sometimes when I was at Sunflower, you saw somebody coming in, sitting alone. You have to assume they're over 60, and then kind of did my little ambassador thing for the senior site. And I would actually help some people with it after the meal was served. But that's tough when they first get enrolled.
Yeah. And one of the things that we have learned is that as long as we have even the year somebody was born and the age, that's enough to provide the documentation that we need when we enter that data into our accounting system. So it's just kind of those tricks of and making people feel comfortable. So, and explaining why we need that information, I guess, because that determines our funding. So, one of the things I will just mention too is that we have started to see an increase in some of the sites with our carry-out meals. Now, we have gotten clarification that when we are serving carry-out meals at the sites, that they needed to be counted as home-delivered meals because of the fact that there is not socialization that is occurring in those instances. So what we're starting to see then is that that's really, becoming a drain on our home-delivered meal budgets. So we're definitely looking closer at that and encouraging people to dine in whenever they can. The way that, we if there are issues such as COVID that are making people concerned about going out and being in public spaces, if there are things like what you're talking about, anxiety, where people don't want to be out, then we will have that conversation with that individual and we can assess them and we can decide if a home delivered meal would be able to meet their needs. So nobody will go hungry, but again, because of the increase that we're seeing in some of the sites, we're really going to need to be encouraging dining in, which then comes out of a separate budget. It comes out of the congregate or the senior meal budget. So.
And the meal sites are okay with it?
We've met with 3 of them so far. We have just 1 to meet with, and yeah, that's a good point, Deb. Again, just to remind you or explain, we met with all 3 of the sites last week, or we had 3 out of the 4 sites last week, and they were absolutely fine with it. They expressed no concerns. We still feel that we'll be able to provide meals to everybody that is of interest or of need. So, and this wouldn't start, we're not, really making any changes at all until March 1st. So we're just kind of preparing people, the senior meals or the congregate meals, even looking at what GWAR has defined that as, is it says socialization is one of the main purposes. And, the senior dining, really one of their vital roles is keeping people socially connected. So.
And you can see how the risk factors are very dramatically different.
Yes, yeah.
Than
Yep.
home-delivered families.
They are. So, yeah.
It makes sense.
It does.
Scott, Melissa?
Mm-hmm. Yes.
I don't know if people, when I'm at the Wannick Center and see people do a takeout, I don't know if they realize that there are 2 separate programs. Maybe that needs to be explained when people come in for their takeouts. That the whole idea for being at the Wannick Center is for socialization, not just to get a meal to take home. It's a touchy subject, I'm sure, but maybe people just don't realize, that it's 2 different programs.
Right, thank you, Beth. And so, really, when we look at our numbers, Wannick has the highest number of takeouts. The other numbers are starting to rise a little bit, but when, like I said, overall, when we met with the other sites last week, it really wasn't an issue with them. Wannick is the highest number. So what we are going to have to do, Beth, when we meet with them tomorrow, is just going to be explaining to both Ashley Pub, who is a food provider, and then to explain with Wannick Center staff, really, now that GWAR has clarified the difference between the 2. When the pandemic started, there wasn't the takeout that was happening. There really wasn't something that had been done in the past, but then takeout had started really across the state because of the pandemic, and people were carrying out food from the sites. So I know Ashley attended a meeting last week. Was it a regional meeting or was that a statewide meeting? Regional meeting with representatives from GWAR and from many other counties, and we are in line with what other counties are doing. Now that just kind of we've been able to just look and see what is actually happening with the 2 programs and how it is affecting the budgets of the home delivered meals. Other states we're in line with what other states are doing. So, but Beth, yes, so we're meeting with them tomorrow and just going to be providing that information to them, really that education about why it's making it difficult and why we're really needing to make that change, and looking for their feedback on how to inform the participants at that site. Because I think what I envision is that we will be attending some of those meals and notifying them in advance that we're really looking to kind of make that change effective March 1st, and wanting people to stay and join us for the meal. But we'll provide that support so that they're not really being the enforcers, so to speak.
The bad guy.
Yeah, you said it. That's what I was thinking, Beth. Yeah. Do you have any other feedback? Because I know you've been at that site a lot, but I think it is just being honest with people and telling them this is going to negatively impact our home delivered program if we continue this at this rate.
Well, I mean, I think it's usually the same people all the time.
Yeah.
And I don't know if they figure, well, it's more economical to get it through the Wanik Center than it is to go to the Ashley Pub itself. Um, I think just talking with the people that take out and kind of explaining to them that, you know, it is two separate programs and it is hurting the home delivered meal program that way. You know, it might change, it might decrease the amount of people coming, but what's the goal?
Yeah, what's the goal? It's to social, have people socialize to reduce the isolation, loneliness, and to provide a nutritious meal. But I mean, mainly that program is for the socialization. So, and they are doing some great things. They have been doing some activities at that site again. So, kind of turning that into that community center, that center where people are gathering for, friendship.
Deb,
Yes, Jeannie.
If this were to impact the home delivered meal, is this where we'd have to deal with that waiting list that I hate?
Potentially, yeah.
Ugh, okay.
Yeah, and I think, again, if these individuals need meals delivered to them, we could certainly achieve that through the home delivered meal program. I think we're kind of generally getting the sense, and maybe Beth, you could tell us more because you're on site there, but it seems to be a lot out of convenience to do that. And the meals are kind of packaged to kind of pick up and go. So I think that who wouldn't kind of maybe think that anyway, right? But I think helping people understand that the purpose of this is to come and stay, to have the socialization. By you taking it and going is going to cause us to not be able to deliver delivered meals to other people. I think people are very reasonable. People are going to figure it out, and they're just going to either stay or they're going to choose to not participate because convenience is more important to them. And that's, I mean, those individuals are in a place that they can make those choices. Our programs are for people who don't have a lot of choices.
Okay.
So
I don't know how we can explain that to people, but maybe if they knew this might create a waiting list, which I'd rather not even think about.
we're forced to have one because the state required
I
it,
know.
but the Human Services Board, thanks to Jeannie, has written it to make it almost impossible. But but again, we don't want to be, I mean, when you
Right.
think about all the needs in this community, people that can't get out of their homes have to be our top priority.
Right, right.
And I don't think any reasonable person would have an issue
Right.
with that.
Right.
And I think you're right about if you go someplace and you get a packaged already meal, you just think, oh, I just can take this home and it doesn't impact anything else. I think Beth needs to be the ambassador down there.
You could help, Beth.
Yeah.
Could we possibly create a slip to put into the bag of the to-go meals, just explaining the situation?
I think that's a
and-
really good idea. Yeah, we actually had created a little slip that we've put, again, the numbers are pretty low at the other sites. And we had created just a little slip that we did give those other sites that they can put out. And it's a good question about the waiting list, because in Ashley's meeting last week with other counties, you found out there were several counties that do have a waiting list, so it has impacted them, and they have now not, they have people waiting for home delivered meals.
Which is like unacceptable to me.
What counties were that? Do you remember, Ashley?
Jackson was on a wait list due to lack of volunteers to be able to support the routes. And Barron County was on a wait list because their provider couldn't sustain the amount of meals needed due to lack of staff. Yeah.
Yeah. So,
Yes, I certainly will help when I come back in March.
okay. And yeah, we are meeting with them tomorrow, just so people are aware. So,
Nancy, did
If
you
you
have a
want to keep
question?
me posted.
I will, yeah. Yes.
Thank you.
Okay. And happy birthday, Jeannie. Enjoy your day.
Okay, are you ready for this? Oh, no. I belong to two. organizations that during the year build up their treasury, and then at the end of that year, they have to disperse it because they're not allowed to have that much money. And the two organizations asked me about donations to ADRC. Are you accepting that kind of donation, or it's like giving to the food pantry or whatever?
Yes, yeah.
Yeah, of course. The county has a donation policy, and the policy was written kind of for all of the things that the county does. It isn't necessarily user-friendly for the ADRC, so we continue to kind of work on sometimes we have to get approvals in advance to accept a donation from the Human Services Board or the county board. So we have sometimes some steps internally, but we're always welcoming those kind of donations so that we can continue to serve the seniors in our community. Again, we are always looking at what do we need right now and what do we need in the future, and so how do we keep services going? Yeah.
So where would they send a donation to?
They should contact me,
Yep.
Nancy, and then, kind of depending on the amount of donation and the kind of donation, like what Deb said, there's different steps that might need to be taken according to the just details of the donation. But they can contact me, and then we can talk about.
Yeah, and the steps are on our side. I mean, they give Melissa a call. Melissa's going to want to know kind of what are they looking at donating, what's the purpose of it, what's the donor's intention. We always want to honor the donor's intention, so we need to know that. And then we have to come back and kind of get some approvals internally, and then we'll be able to accept the donation. So
you're saying that I would have to tell them where the money's going?
if they have a preference, if they're like, no, I just want to do good and give it to the ADRC, that's fine. If they say, I want to be able to use it for the senior nutrition program, I want to be able to use it for the caregiver it's that the one thing about getting donations is you always have to be really respectful of the donor's intentions. Sometimes they just want to do general good. Sometimes they're like, this program or this service means a lot to me. So again, understanding that so we can use those resources to fulfill that request.
Okay, thank you.
If you have lots of money left over, NAMI's always looking for donations too. Just had to throw that in, sorry. Okay, we've talked a lot about the meal program. Did something else, Nancy, did you? Oh, okay, you're still on, so I didn't know. So let's move on then to caregiver, or that, not caregiver, dementia care specialist program, so.
So I have just a few papers, I'll pass out quickly. I was going to have a presentation today, but technical difficulties for now, so I can always do a presentation at the next one.
We choose.
Okay, sounds good.
Yeah, I apologize. I did not, I was not aware that IT, so the IT department would need to help us in advance with a PowerPoint. I just thought we could basically set up her computer and she could do her PowerPoint presentation. So that is something I neglected to do. So now Becky's just going to give us today an overview of her position and what she does. And then I think it'd be great if she could come back maybe at our next meeting and kind of provide a little more detailed presentation of what she does. So thank you, Becky.
So I started in the role back in July. So since then, I've created some nice handouts and also with the help of other DCSs in other counties. So the Dementia Care Specialist goes by DCS. So with the expansion this year, now all of the counties in Wisconsin will have the opportunity to have this position in their county. So I will be the DCS just for Trempealeau County. So you can see on this first page, the purple one, it outlines what the position is. So with the position, there are the three main pillars, and you will see that listed. So one of the main things for the position is working with the caregivers. So offering multiple different supports. For example, I'm a part of 2 different support groups that happen on a regular basis. They are happening virtually at the moment, also because it's multiple DCSs from other counties. We're all taking turns facilitating. So also different programs that I've been trained in, so I will be able to be offering those. And then the second pillar is working with the person who has dementia or mild cognitive concerns. So whichever that might be, it might be just somebody who's very curious to know about where they're kind of standing with their memory. So example, back in November, I was at multiple different libraries in the county offering brain screens. So they're brain checkups. It's a very simple little 10-minute test that I can provide to somebody and kind of gives you a general outline, kind of where your memory's standing. So then if you do have concerns, then I have some general brain health information that we can talk about. And then ultimately, if you're having more concerns and more questions, I recommend you talking with your doctor. So there are kind of these nice purple folders that I put together, took to the library. So it just the 10 different signs of dementia, and then just also good brain health information, brain healthy diet. Yeah.
For the record, I just barely passed.
You did just fine. So that is something that's always offered that myself and then also other ADRC staff have been trained on. So that's something that people can do over the phone as well. If you're not able to make it into the office or we're not able to make it to you or you just prefer to do it on the phone, that is also an option too. So just the main general helping with brain health, ways to stay healthy. And then the third pillar is community and professional support. So that is doing different trainings in the community, working with different businesses and different partners, just more of the basic education and knowledge about dementia and how to better assist someone who has dementia. For example, the CCU Bank, the 2 locations in Galesville and Shrum went through a training where it was a training to simulate, so they were acting as if they had dementia and then just more education on it. And also, I'll be working with TCC to get them training this coming year too. So all their staff will be taking that.
So I'm just going to jump in, Becky, and just say that would be something, this kind of training that Becky will be doing then with TCC. That is something that Becky could do to other groups that you may belong to or, may be aware of, is just we're trying to, meet with as many people that we can, including businesses, and just letting them know about dementia and all of the services and just things that may be of assistance to caregivers and to those with dementia. So.
And another main big role as well is for the ADRC staff to be dementia capable. So what does that mean? That means that just the ADRC staff have the basic knowledge and understanding about dementia, and that then they're able to better assist anybody that they're working with. So that's something that's always an ongoing training with the staff, that's talking at a staff meeting about a new article that's come up, or whatever information is evolving, because as we know, everything is always changing and something new is always coming down the pipeline. And you'll also see too at the bottom of that purple paper is my contact information. So kind of then too going about like what Melissa said. So on the next sheet is a white paper. So it lists all the different things that I could possibly do for somebody in the community. If it's for community support, if it's support for a caregiver, if it's support with someone who has dementia. So it lists some of the different programs that I've been trained in that will be happening. So for example, there's one, it's called Powerful Tools for Caregivers. So that one is on the back side of the page, and it just goes in depth a little bit more about it, but it's a program that I'll offer for caregivers. It'll be an evening virtual program, so also hitting anybody who is a working caregiver who's not able to attend things during the day. It'll be an evening program that I'll offer with another dementia care specialist from another county. And then same with the Savvy caregivers as well. So those will be happening in the next couple months. And I always, when we have our ADRC newsletter, things are always listed in there under brain health, different things that I'll be offering and doing. So this is just a nice sheet that I have created, so there's when I'm meeting with people, so people are knowing all the different things that could be offered in the community. And then today, actually happening later today, the Alzheimer's Association of Wisconsin is also offering an advocacy day. So you will see that the two charts that are also in your handouts, that's actually from their packet from today that they are offering. So it just shows a little bit more in-depth numbers and pictures about, more public awareness about Alzheimer's and dementia that is happening. So if anybody's interested and would like to know more about what's happening today, I printed off a couple packets that go through the different talking points that are happening today. A big part of my position is working with other dementia care specialists from other counties. So one of the regional groups that I work with, we offer, when we're offering any of our virtual programs, we're offering them to anybody we serve in any of our counties. So there's a nice flyer that I send out to the caregivers that I'm working with via email, or I can mail it to them, but it just shows the different education and programs that are being offered each month that someone can join. And all the programs are free of cost for someone. So just kind of a quick overview. Then also another thing I've been working on is updating the dementia care resource and support booklet. So when meeting with a caregiver or someone who has dementia, it's a nice little booklet that puts a lot of information together because there's a lot of things to think about and go over. So that will be coming out shortly with more reviews to make sure it's good to go. So kind of a very quick, brief overview. Does anybody have any questions?
So I guess if any of you know individuals that have dementia, or if you know of individuals that are a caregiver for somebody with dementia, certainly you should tell them to contact Breckie, because she will, she's just a wealth of knowledge about dementia and knows, so much about resources, that there are funds that we have that would be able to help individuals as well with items that can assure safety and items that just can make life easier for those with dementia and their caregivers. So, just get the word out that we do have, this dementia care specialist at the ADRC. So we want people to know.
Thank you, Breckie. That's very, very interesting, and it sounds like you've got a lot going on, and it is a wonderful thing. Dementia is a big thing, especially with most of our age group. I was in Florida at my sister and brother-in-law's home over Christmas, and my brother-in-law is starting to, I think, early stages of dementia. I mean, I literally watched him walk out of the house, put the key in the door to lock it. My sister and I were in the car already, and he kind of had this funny look on his face. He went back in the house, and he came out, and he said, "Gail, I can't find the keys." And it was, momentarily, he put them in the door, and it was gone. So, and then, like a couple weeks ago, he lost the sight in his left eye. So, not dementia related. I think it was blood vessel or something. But when you're in your 70s, you start having lots of issues, and so thank you for doing what you do and being there. And I think all of us probably know someone that might be able to use the services. Nancy?
I'm wondering, there are times when I think I'm slipping. Now, if you do that brain health thing, can you determine whether a person like me is headed for that trouble, or?
Well, not exactly, because I don't have a glass ball. But ideally doing a memory screen, that's something that you could do every 6 months. So you would do it, and then I would give the records to you. So whatever you would like to do with them, if you want to keep them, you can start with a baseline. So in 6 months, then you can see where you're sitting. So
I would get in touch with you?
Yes. Yep.
Okay, thank you.
And then she would be able to, if you were interested, she would be able to provide you with some, recommendations as far as if you did want to, talk to your doctor about this, that would be really kind of the next step. You would take that to the doctor then, or could be a next step, if you chose to do so. But, even in Scott's example, some of the things that Becky would be, able to do would be to meet with them and then talk about, are there safety concerns? She'd be able to help maybe create a safety plan. Maybe there would be some technology items that would be able to be helpful to the couple. So certainly education is important, and just letting them know then what is available to them. So.
And also another thing to keep in mind, there also are many different things or medications that interfere with your memory and your brain functioning. So it might not mean you have dementia. There could be another medical condition going on or something else that could be causing you to experience those symptoms. So that's something to explore too, that in my nice little folder, there's some things that are listed there as well. Yep.
I think that even includes a lack of vitamin B12, doesn't it? That if you have, so there's all kinds of things that can cause it. It may not necessarily be the plaques in the brain. It may be lots of other things. So if you want to go to Naples, Florida, to visit with my sister and brother-in-law, just teasing. Any other? Yeah. Yeah, the temperature is warmer down there for sure. Any other questions or concerns?
Becky, this is Paula. Can you hear
Yes,
me?
Paula.
Yeah.
Barely.
Maybe 18 months ago there was a class, and I don't know if it was through the dementia specialist, called Swiping something, and it was for people that
Sip
do
and
have
swipe.
memory. Swiping.
Sip and swipe.
Okay. And is that something that might be offered in the future again?
Well, that program, my understanding, I believe this is the case, that it was aimed at just seniors in general. That was the intended population. So just seniors, to teach them to do technology. So we don't have any classes scheduled right now, but that is certainly something that we could look at offering in the future. It's interesting because TCC, who Becky is going to be working with to do some dementia training, they also provide some trainings for seniors with technology. So, I think that's also a potential partnership that we could explore.
One thing, Paula, that I will be offering, I had did a class a few months ago. It's called Boost Your Brain and Memory, and it's geared towards all about brain health and kind of dives deeper into brain health. So that is another class that I do plan to offer at least 2 times this year. So if it's either one is virtual or in person, but it is a nice program that really just dives deep into brain health and just different ways to keep your brain healthy.
Thank you, Paula. Other comments, questions? Now is the section where we can bring things up, public comments. I've got one that's going on right now with computer, and it seems it's from a person that I've known for many, many years. She was on Unified Board of Directors for years. I think she was even on the county board, and I don't think it's her, but I'm getting messages on Facebook, and it has to do with, I believe it's an SSI scam, SSI being Supplemental Security Income. And she's claiming that my name is on a list and I might be eligible for $150,000. And just last night I responded, that's not how SSI works. She said my name was on this list, and and I think the person is fishing for me to call this number and then start getting information. So somehow I've got to try to find her phone number and ask her if it's actually her or if somebody's just using her persona, which generally that's what all these scams are about. They try to they fish, they try to rake you in so that you call a number or you click on something. And I got one the other day, name I didn't recognize, but here are the pictures. Feel free to send them to anybody you'd like. And it was just a line, and I just deleted it. Even though your human curiosity is there, delete just about everything that comes through on something like that. It's just going to be a scam.
I have to relate the phone call that I got. Eileen was at my house when they called.
Oh, now you're on. Oh, now you're off. Somebody turned you on, and then there you go.
Oh,
Now you're ready.
okay. Technology, I don't go along with that. I got a phone call that day, and they offered me, or they told me I had won $40 billion, a new Mercedes, 17,000 some dollars a week for the rest of my life,
Lucky you.
and something like that. And I kept asking him questions, and finally I said, you know what, I don't believe you. Plunk, he hung up. But imagine calling somebody with that, you know right away it's a farce.
So I'm in the age group that would be covered by the ADRC because I have a 6 in my number. And as I have moved into that category, I've gotten a lot more scams. And so one of the things I would strongly advise is if you are on Facebook, there's a birthday section. Don't put your birthday in, and for sure put in the year like 1998 or something, so that, because as soon as they see you're born in the 30s, 40s, 50s, you become a target. So if you can go in and change the year or anything, or just take it out, or just make it private that only you can see it, that's on Facebook, which is the new place where scams are really blowing up. That can be really helpful, because I noticed that I suddenly start getting all these scams, and I'm like, well, how did I not have any, and now I suddenly do? But they look for people of certain ages, and your birth year will tell you a lot. So I just would put that out there to protect people.
I get a lot of telephone calls, and I have a gardener, Denise, and she's in Mississippi Valley Gardens, and I told them, I said, don't call me anymore. If you want to call somebody, call Melissa. Call Denise and talk to her. She's my helper. And I got mad at him, and I hang up on him. And he called me back, and he said, don't hang up on me. And I said, jeez. I will hang up on you because I don't want you to call me anymore.
Good for you, Mary. Stand your ground.
I was mad. I was calm and cool, but I just got mad at him, and I said, don't call me anymore.
I don't know if they listen when you tell them that, but.
Well, and again, they prey on understanding that those of us of a certain age were raised with certain ways of treating people. And so being rude was not something we were ever told to do or allowed to do. And so they prey on that, and they do say, don't hang up, because that would, in most people's sensibilities, bother them. Thank goodness, Mary, you had the good sense to just say, I'm going to hang up, and did hang up in the first place. But again, they really look at how old are you, what are your sensibilities of your age range. They really know how to play on people like that. I'm looking forward to growing old, but that's not one parts of it.
I told him to lose my telephone number.
Beth?
I see on the agenda, excuse me, our next meeting is not till April 12th. So depending on the elections, and I'm not sure when the new people take office, without looking at my calendar, but this may be my last ADRC Advisory Committee meeting as a representative from the county board. So I do want to say that I have truly enjoyed my 2-year tenure with you folks, and hope I can continue. But if not, thank you for teaching me lots of things and helping me become much wiser in the aging world.
So
Well, thank
Beth,
you.
yes, Beth, I appreciate you mentioning that. There's a lot more competition on the county board this year than we've seen in a long time. So I hope you're able to stay on. In the unlikely event that isn't the case, we always have openings for people of the general public. So that would certainly be an option if you'd like to stay part of this group, Beth. So keep that in mind. You
Yes,
might not get rid of us that easy.
Yeah.
I don't want to get rid of you that easy. I just would be disappointed that I can't be more active with this group. So yes, I would be interested in keeping on with the group.
Well, thank you, Beth.
Yes,
yeah,
thank you.
Thanks for all that you've done.
We've appreciated your input over
Yes.
the years. It's, you've had a lot of good experience, and maybe we can continue. Like Deb said, we're always looking for someone, and when you've got 2 years' experience, you know, your resume kind of jumps to the top, so.
Absolutely. Thank you, and thanks
Beth,
for.
when we did the open house, when we moved to the ADRC, you were one of the first people there, and you were the only county board member there. And I remember that, and that made a huge impact on us, and that just talks about your commitment to the work of the ADRC and what we're doing. And I just want to say thank you for that, because that was just one physical representation of the work you've done for us. So, and hopefully this isn't our last conversation in this capacity, but I just had to say that, because that was a big deal to us.
And it means a lot too, that just your interest and your assistance at Wanik Center. You know, Beth has helped us out a lot there. She's been there at a lot of meals. So it's been great. We can't thank you enough for that.
And I want to piggyback off of Melissa and say thank you so much, because you have been very instrumental with the rollout of Wanik. When we called upon you for volunteers that day, you jumped right into action and helped us serve meals. So thank you for really helping us promote Wanik and being there and interacting.
Thank you for all the comments. I still can help out at the Wanik Center when I get back.
Thank you.
Yep, she's from Arcadia. Anything else that people would like to say? We're approaching noon already. I'd like to thank everybody for coming and your input and for your vote of confidence on my chairpersonship. Got to be appropriate with my language here. So I'd entertain it. Well, I guess we don't even have to. We've come to the end of our agenda, and so we don't even have to adjourn the meeting. It's something that Jeannie has taught me over the years. So I guess the meeting is adjourned. Thanks for coming.
There is a nutrition meeting following this.
Oh, okay.
So for those that are part of